So let's talk about processed food addictions. From your experience, do people develop these addictions later in life, or do they really start very early on in their childhood and then they find out later in life that this is just out of control?
Yeah, such a good question. And I think there's probably a mix of all of it. I would assume that genetic vulnerability from parental history of addiction or alcoholism can be a risk factor for people having dysfunctional relationships with food. And as we know, the relationship with food is imprinted early in life. So children get access to ultra-processed foods and are using them for reducing negative affect or quote unquote feeling better. Sometimes people use the term emotional eating. And I think if that pattern is imprinted very early on, it's likely to leave a legacy that will stick with people throughout their lifespan. Not to say that it can't be overcome or reversed or just become a thing of the past. And then I do think that some people develop it later on in life. The data on food addiction, ultra-processed food addiction, suggests that the prevalence is higher in adults than it is in children, which would point to the fact that it's like other addictions in the fact that it develops slowly over time with chronic exposure. So, addictions like cocaine and nicotine, as you mentioned, usually start to happen in the teen years, in the early 20s. That's like the common time. And it takes time for the addiction to really get cemented in the neural pathways. And I think that's probably true for food as well. And the last thing I'll say about it, if someone has another addiction, like if they have cocaine addiction or alcohol addiction, and then they stop, there's a higher likelihood that they'll cross addict into ultra processed food. And if someone has significant trauma, PTSD symptoms, it's also very likely that they could develop addiction-like eating patterns as a result of the trauma.